Great.
Greetings, everyone. I'm Dr. Catherine Y. Brown. Today, I am very excited to introduce you to my guest, Dr. Jason Weatherald. Welcome, Jason.
Thank you for having me. It's a pleasure to speak with you today.
Thank you. For our viewers, can you share a little about your background and also where you're joining from? Because they'll be very surprised.
Sure. In contrast to my background, I'm not in the south of France. I'm in Edmonton, Canada, and it's almost as hot here as it is in France. But I am a lung specialist, a respirologist. I specialize in pulmonary hypertension as well as lung transplantation. And I did a lot of my training here in Canada, but I also spent a year in Paris doing research in this area after I did my clinical training.
I love it. You know, we don't always meet people who specialize, right? And so I want to know about your journey and when did you come to know those two words, pulmonary hypertension, and then what inspired you to do all of the things that you do to help?
It's a great question. I don't know if there was one specific instance that really inspired me, or rather than sort of the cumulative experience of patients I saw early in my training. I didn't really hear about pulmonary hypertension until I was a resident doing internal medicine, and I was doing an elective in another city and did a clinic with some specialists that see this. And I was, I encountered a few very young patients with this disease who were doing really well on the medications that are available. And it was just really incredible to me how the field had progressed since the 1990s. This disease had really no treatments in the 1980s, and the survival of patients was usually about 2 years after they were diagnosed. And there had been just, by the late 2000s, there were multiple treatments available. And so it was really exciting to me to see how this disease had been transformed from a death sentence into sort of a disease that could be managed, chronically, even though it remains serious. And there was just a lot of exciting research going on. And so what I really loved about it was that it was, I was interested in the time in lung medicine, but also in cardiology, and it's a disease that kind of overlaps. And so it allows me to do both. And I'm really interested in the heart and the lungs and how they interact with each other. And this is the quintessential area that does that. And then I had a lot of patient experiences that just really, moved me and inspired me to get involved in this area.
Amazing, amazing. So how do people, I know it's usually referrals, but what is that process for someone to be seen by you, and what is that journey like?
Yeah, it's variable. Like, there's a couple of ways that people come to see me, and often they have breathlessness, and it can sometimes take months or even years for them to get diagnosed because it's a rare disease. And so eventually what happens is someone thinks to do an echocardiogram or an ultrasound of the heart, and that's how it's discovered. And then they find their way to me through referrals. The way it works here in Canada is that the care for these patients is highly centralized and usually academic university associated centers. And so we see patients from a very broad region, geographically quite a large referral area. And so usually they're sent to us by a cardiologist or another lung specialist or their family physician. And that's the process sort of involves looking for all of the potential causes of pulmonary hypertension, because there's many different diseases that cause it. And the treatments are very different between the underlying causes. So my job is to sort of figure out what the main mechanism, what the main disease process is, and then to direct treatments based at the underlying cause.
Absolutely. For those people that are watching that aren't familiar with pulmonary hypertension, how do you explain it to people? Because everybody explains it sometimes a little bit differently.
Right. The way I explain it to patients and also to the trainees that work with me is that pulmonary hypertension is not a disease on its own. It's an abnormal finding. It means high blood pressure in the lungs, and there are many diseases that cause it. So in many ways, it's kind of like saying fatigue or anemia, like a low blood count. It's not a diagnosis on its own. It's an abnormality that has to be explained. And what we do is we look for the reason why it's happening. Why is the blood pressure in the lungs high? And it can be due to heart problems. It can be due to lung problems. It can be due to severe sleep apnea in some cases. So we need to get to the bottom of the underlying cause, and that's how we direct the treatment.
Absolutely, absolutely. Is there a certain age range that you tend to treat? Because, you know, you already know it can span. The average person doesn't know, they hear it and they think of an older adult, which is not always the case. So what does your demographic look like on average, if there is an average?
Yeah, I mean, we know from data from the US pulmonary hypertension registries, as well as our Canadian registry, that the average age is now about 60 to 65, which is much older than what we used to think of when we thought about primary pulmonary hypertension, or what we call now PAH, because you know, the early studies suggested that this was predominantly a disease of young females in their 30s and 40s. But, you know, as we've gotten better at diagnosing it and our technologies have gotten better, we see a lot of people who are older, even in their 70s and 80s. And it's more complicated in older individuals. It's hard to, you know, really figure out if there are multiple causes or if it's one cause, like of the lungs with some heart disease involved. And so treating those people tends to be a bit more complicated, but you know, we have to treat the person in front of us. And so sometimes it depends on what their wishes are or what their goals are, and what kind of risks they're willing to take with the therapies that we have. And unfortunately, the drugs that we have available to treat pulmonary hypertension aren't always more effective or as effective in older individuals, particularly when they have other medical conditions. But, you know, we don't really know until we try. So sometimes we give it a shot and see how people respond, and then make decisions based on their response.
Absolutely. With the nonprofit, our mantra is awareness, empowerment, and hope. Together we can make a difference. And we focus on patients, caregivers, medical professionals, and the community. With your expertise, what is your recommendation of how we can get more providers and medical professionals who are not as familiar with pulmonary hypertension to be more engaged? What is it that we need to do?
I think the word you said, awareness, is the most important, because a lot of people have their symptoms blamed on other diagnoses, or like being overweight or having mild asthma or something like that. But it's always something, I think we need to raise awareness among the public, but also among primary care physicians and nurse practitioners, you know, people who see people for their initial symptoms, because it's a rare disease. But if you don't think about it, the delay in diagnosis can be quite significant. As I mentioned, sometimes up to 2 years, and we don't want to lose the opportunity to treat the disease early, because we really do think we can make a difference if we treat people early. We can improve symptoms, potentially delay the disease progression, and improve outcomes. So I think raising awareness, making people think about it in people who have symptoms like breathlessness, and to, you know, order that echocardiogram as soon as possible in the course of the workup, especially if things don't really make sense otherwise. If there's not an obvious diagnosis, we need to think about this.
Absolutely. And I love what you said, getting the diagnosis sooner so that we can get the treatment to the person sooner, obviously, because we're dealing with quality of life. So that's so important. I'm glad you brought that up, because people definitely need to hear that. So what does a day in your life look like? I'm so curious, and everyone is curious as well.
Yeah, it varies from week to week, which is what I love about it. It's not boring. It's always different. So some weeks I'll be on call in the hospital, and that involves taking care of patients who are post lung transplant or with pulmonary hypertension, who are really sick, and they're in the hospital for a week. And so those are really busy weeks, but it's always, you know, interesting and exciting, and we can often make a big difference. And then other weeks, I'll just do research maybe for a week. I'll work on research projects. So it's not in a lab, it's kind of just sitting in front of a computer crunching numbers, but it's interesting to me. And other weeks I'll be in the clinic seeing new referrals and seeing patients that I've been following sometimes for many years, adjusting their therapies, or sometimes just making sure that they're doing okay, which is our goal. And so the variety is what really keeps me engaged. It's not the same thing every day. It's always different. And that's what's really fun about it.
Listen, that is amazing because I want people to hear what you said. That's what's fun about it. So hopefully if we have any students or future medical students, they'll listen to you and say, hey, I can do that. And I like research and crunching numbers and seeing patients. So you get a kaleidoscope, it sounds like. No 2 days are alike. And that's the beauty.
Exactly. Yeah, it's an exciting area, and I think it's an exciting time to be in the field because there's we kind of stagnated and plateaued with the treatments we had available for about a decade, and there's some really exciting new treatment options coming down the pipeline, which hopefully will work out in the big clinical trials. So I think the next few years will be very exciting for us and also for the patients who may have some new options to treat their disease. So.
I love it. So you're doing research. So that means you're doing publications too?
Yeah, as that's the goal. That's part of the job description. So I do mostly clinical research, and I've worked with some big databases and registries to sort of look at, what are the outcomes for patients right now, particularly in Canada, and how do we use ways of risk stratifying patients to make clinical decisions? And that's what most of my work has been in the research field. So I've got a handful of publications in that area, and that's always fun to make a difference, and people use the research that you've done to make clinical decisions. That's ultimately what the goal is.
Wonderful. So I do have two more questions, but the one is a fun question. I've asked you a ton of questions. Is there anything that you want to share that I have not already asked you?
Wow. I think for patients with this condition and families, it's to, make sure that you advocate for yourself and think about participating in research, because that's really the only way that we advance knowledge and improve outcomes for patients now, but also in the future. So I really encourage patients to think about, participating in clinical trials if they're eligible, because you never know what new therapy is going to be the one that makes a big difference. And so that's the best way to get early access to things and to help people in the future. So I think, that can give people some comfort that they're helping improve things down the road.
Wonderful, wonderful. And I'm glad you mentioned that, because a lot of times when we hear research and clinical trials, many people may get afraid. But like you said, that's the only way that we can actually learn is through this work. And it's closely monitored. And a lot of people don't know that it is closely monitored. Everything is that's done. So
Exactly. Yeah. Very, very closely monitored. We take a lot of care, and we want to be careful with new therapies, but everything we have now, we owe to all of the patients, some of whom are gone now, who participated in those trials in the past. So, because of them, we've improved outcomes and patients live longer and feel better. So we only move forward by acknowledging that.
oh, I love that you say that, because it does. It makes a difference. My mother was a nurse for over 40 years, and she believed in that, hey, she would always say, whatever parts they can have, give it to them, because I won't be here. Just, help the next generation, right? So what words of wisdom would you give to someone like me that's on a road, on a journey to interview 100 people and just trying to increase awareness of pH? That's my final question for you.
Wow. I mean, I think, my advice is to talk to people who go through the journey with patients. So the patient story is really important, but this is a disease that puts a lot of stress on caregivers. And I think there's a lot of really rich stories in asking the loved ones of people who have had this, the people who take care of the patients, because they're the ones who are doing all the research around it. They're the ones, looking into new therapies, and they're the ones that help people, get through this disease in a dignified way and provide that support. And so, doctors get a lot of notoriety for participating in this field and doing research, and the patients, are the focus and the center of it, but don't forget about the people around them that participate in the journey, because they have a lot of really important insights and experiences.
Wonderful. And to me, you affirmed our focus, which is patients, caregivers, medical professionals, and the community. It takes all of us to make a difference. Well, I want to thank you again for being here with me today, just so people can hear your journey. How can people get in contact with you if they want to know more about your work?
Yeah, I mean, the best way to find out about the work is through you can look at the research that we've done on something called PubMed, which is a search engine. You can look up publications that we've done, or by email. Like my work academic email is public information. If you Google me, you can find it. And trainees, other doctors, patients, happy to speak to people about this, because this is what I'm passionate about.
Oh, thank you so much. And thank you all for joining in to learn and meet Dr. Jason Weatherald. Until next time, I am Dr. Catherine Y. Brown. Please like and share this message with those around you, because it takes all of us to increase awareness of pulmonary hypertension. Have a great day, everyone. Bye. Thank you, Jason. You are the best.
You're welcome. It's a pleasure. Thanks for doing what you're doing. This is awesome.
Thank you. And great information. Like, I think you really helped us understand the whole kaleidoscope of things. So it was wonderful.